Hello everyone, today we are going to be talking about the ECG chest leads, also known as the V lead, also known as the precordial lead. They are called precordial lead because they are attached to the chest, right? So one thing to remember before we dive into the topic is the chest lead, they are looking at the heart in a horizontal plane, right? Not in a vertical plane. Unlike the limb lead, some are found at the bottom, some are found at the top of the heart. While the chest lead, they are oriented from a kind of in a horizontal fashion, right, of the heart, as we are going to see in a minute or in a second. So this is our heart as usual. This on the right side, this is right ventricle. This is the left ventricle is more thicker, so it will going to be having the strongest depolarization wave, and it is the one that is going to be determining the direction of the wave, not this right ventricle because it is smaller. So the V1 and V2 they are found at the side of right ventricle. V3 and V4 they are looking at the septum. V6 and V5 they are looking at the left ventricle. And if you really want to see Q wave, if you really want to see Q wave as it is very prominently, you have to look at V6, right? And we will see why. And also before we continue, we have to know that in any ECG pattern, the first positive deflection that is upward, the first positive deflection that will occur is R wave, while the first negative deflection that will occur, that is downward movement, is a kind of Q wave in any lead, right? So this is a V1, and we have to know that the septum is depolarized from left to right, from left to right, from left to right. So if we take this V1, and the septum is the one that is depolarized first before the bunch of the ventricle, and it is depolarized from left to right. So if we take this V1 actually, the V1, when the septum is first depolarized, some kind of small electrical activity, no matter how small it is going toward the V1 and this V2, right? So let us take the V1, is going toward V1 and V2. And one thing to remember is in V1, the P wave is also embedded. The P wave is also embedded, just like in AVR, right? So that is it. So this is this is a P wave, and the P wave is even significant because if you really want to see P wave, you have to look at lead 2, right? So that is it. So this is V1, and this the polarization from left to right is going toward this V1, right? So this will show a kind of positive deflection because but it is going to be very small because the septum is small in size, right? So, and we have already said that the first positive deflection will going to be R wave. So this is the R wave of this lead 1. This is the R wave of this lead 1. So, as we have already said that the left ventricle, it is one that will going to determine the direction of the depolarization wave because it is the one that is receiving the strongest electrical activity because it is very thick, right? So the impulse direction will going to overweight the one that is at the right side. So now we will consider the impulse direction to be going toward this side in terms of the polarization of the ventricle, right? So that is why we can see in the V1 and V2 the impulse will going to go away from V1 and V2 because we are considering this. Also the impulse are going toward the right ventricle, but since this is more thicker, so this one will going to be determined where the ECG lead will show. So that's why it is going to show a kind of negative deflection, long negative deflection, right? Like this, because the impulse is going away from them, right? So that's it. Even though some impulses are going toward them, but this it is one that will determine, not the small one for the right ventricle. So that is it. And then the T wave will going to also be a kind of inverted like this, because so we can say the QRS complex in V1 is also inverted, right? Just like AVR in the limb lead. So that is it. So the V1 and V2 are going to be the same. Only that in V2 the P wave is upright, not inverted. So let me draw it in the different. Yes. So we're going to be like this, upright. and then impulse, little impulse toward the B2. We're going to show a kind of small upright, that's R wave, and then impulse are going in terms of the polarization of the ventricle away from the B2. So definitely we show a kind of long negative wave. Then this is the T wave. This is the T wave. So that is it. So now we are going to see the V3 and then the B4. As we are moving toward this side, the S wave is becoming shorter because they are moving toward the strong electrical activity. So this negative deflection is going to be very shorter toward this side, right? So that is it. This is the B3. So for the B3, they will kind of show this is the P wave, right? And then the R wave is going to be a little bit taller, like this, and then this will going to be shorter than the S wave here. This is the S wave, right? Because it's a negative deflection. So like this, and then very tall T wave. That the T wave is a kind of very tall, right? So that is it. So now for the B4, actually this is the P wave. So the R wave and the S wave are going to be equal. Some textbooks they used to say the B3 and in the B3 and B4 the R wave and S wave are equal. Some used to say mostly the S wave and R wave are equal at lead 4, because as you are moving toward this side, the S wave is becoming shorter and shorter to the extent that it is going to look like the same in length with the R wave. So this is it. So this is a tall T wave. So that is it. And then how about in lead V5? In lead V5, actually, the impulse, they are kind of away from this repolarization of the septum. So now they are at this side, right? So when the septum when the septum is depolarizing, then definitely a kind of negative deflection we're going to show in this B5 and B6, because when the septum is depolarizing, the impulse are going away from this B5 and B6, right? So this is where we will see our Q wave, because it is going to the first signal will going to show in this B5 and B6, especially in B6, will going to be negative, like this. Will going to be negative because of they are opposite in the opposite side of the that is behind the direction of the depolarization of the septum. So they are going to show like kind of like this. And we have to know that the R wave of this B5 is even taller than the V6. Why? Because the direction of this depolarization wave is directly pointing at this B5. This one also can show a kind of positive R wave, but not as taller as this, right? But this one, it is where we will see the more prominent Q wave than this B5, because it is the one that is more behind to this this Q wave. So whenever this Q wave is depolarizing, directly the impulse are going directly away from this B6. A little bit, this is more kind of having a kind of positive than this in terms of Q wave. So this one, the Q wave is not going to be prominent as in this B6. So in B6, the Q wave will going to be prominent, because the Q wave is the first negative deflection, as we have already said in the first part of this video. The first negative deflection is Q wave, and then the first the first part of the heart to depolarize in terms of before the ventricles is the septum, right? So when the septum is depolarizing in this direction, the impulse are kind of going away from this B6. So it will kind of show a kind of negative deflection after the P wave. It will kind of show negative deflection, right? And then when you come to the depolarization of the ventricle, the impulse are a little bit toward the B6. So this is it. So it will kind of show a kind of tall R wave. Then this is a T wave, but it will not going to be as taller as in V5, because the direction is going to be toward the B5. So that is it. So this is B5. So this is going to be B6. This is the Q wave will going to be more prominent and we're going to be taller than. This will be more taller, so don't mind my drawing. This will going to be a little bit shorter than this because the electrical activity is pointing directly to this V5. So this B4, it is R wave and S wave equal in length, because as we are moving toward this side from B1, the S wave is becoming more shorter, V2, V3, so it is becoming reducing in length to the extent that it will going to be the same in length with the R wave, right? So this is called a transition point. So why this transition point is important is because in patient who is having a kind of right ventricular hypertrophy, due to, for example, pulmonary stenosis, or due to chronic lung disease, because in chronic lung disease the right ventricle become hypertrophied, right? So the heart will going to be tilted toward that side, like this. For example, this is the heart. So here we have the B3 and then the V4, right? So the heart will going to be tilted so that the septum will now going to be looking at the V5 and V6 when it is tilted, because the right ventricle now is very huge. So the heart is going to be tilted toward that side, so that now the septum will going to be looking at B5 and B6 rather than V3 and V4. That is why our transition point will going to be at B5. That is, we will see that at V5 the length of this R wave and S wave will going to be equal. So unlike in normal, we know that the R wave and S wave become equal only in V4 or in V3, right? So that is it. So the moment you see your B5 having S wave and R wave the same in length, then definitely suspect right ventricular hypertrophy, because in right ventricular hypertrophy the heart is tilted to the extent that now the septum will going to be looking at the in line with the B5 and B6, not in line with the B3 and B4. So that is it. So this is the end of this video. So I hope this is helpful. Thank you.